This is Crystal Fenn with MedPage Today. I'm here in San Francisco at the American Society of Hypertension meeting, where researchers have reported that kids with hypertension measured by ambulatory blood pressure monitoring may be at greater risk of left ventricular hypertrophy. Dr. Alisa Acosta from the University of Texas reported these findings at a press conference.
So in summary, left ventricular mass index and the prevalence of LVH significantly increases with the progression of ambulatory blood pressure stages. Youth with severe ambulatory hypertension are over 2.5 times more likely to have LVH independent of their age, gender, race, ethnicity, and BMI. And when blood pressure was staged by casual blood pressure alone, there was no association with LVH after adjusting for BMI. So in conclusion, ambulatory blood pressure monitoring is superior to casual blood pressure measurements alone in describing a child's risk for LVH. And the American Heart Association recommendations for staging ambulatory blood pressure appear to predict childhood risk for LVH more accurately than office measurements alone. An improved identification of patients at risk for target organ damage will allow for early treatment and delay the onset of overt cardiovascular events.
Dr. Acosta emphasized that these findings should raise awareness of hypertension among children.
I hope that it just continues to raise the awareness that childhood blood pressure is important. I think we were just at a meeting last week that was at the American Society of Pediatric Nephrology, and amongst the nephrologists there's a lot of frustration that pediatricians really aren't even measuring blood pressure, and if they are measuring blood pressure, they may or may not be measuring it correctly, and if they are measuring it correctly, there may not be so much of an awareness of exactly how. The charts are time-consuming and difficult to use. It's not like we have an easy value in children to say, okay, 140/90, they're hypertensive, we'll refer them on. It's labor-intensive to look this up and everything, and so I hope that with more evidence like this, it just kind of keeps raising their awareness and realizing that they really are at risk for having early evidence of cardiovascular disease.
So children who meet the ambulatory criteria for hypertension may be at greater cardiovascular risk, but early intervention may be able to prevent further progression of this cardiac damage and also future events. I'm Crystal Fenn, MedPage Today.